8:13, healthy skin starts with the right routine, not just for us adults, but kids too. It's important to take the steps to keep skin healthy all year long.
Joining us this morning, Dr. Priya Nayyar from Clinique with a look at the kids. We've talked a lot about back to school, right? Kids getting back into a sleep routine, back into the school routine, back into a skin routine too.
Yes, it's very important. But as kids and young kids and teenagers head back to school, the most important thing is simplicity.
Yeah.
So for our younger kids, they really just need a gentle cleanser, a nice hydrating moisturizer if they do have dry skin, and then SPF 30 or higher for their sun protection before they head out of the house. Now for your teenagers, they're going to follow the same routine, but if they are showing signs of acne development, then they are going to swap out that gentle cleanser for something that contains salicylic acid or sodium hypochlorite or even your traditional benzoyl peroxide.
I have a hard enough time getting my kids to brush their teeth, let alone follow a skincare routine.
I know.
So this would be tricky, but how do kids' skincare needs differ from adults?
Well, in adults, it's more multifactorial. So especially in women, you have the hormonal changes. So pregnancy, menstrual cycles, stress, perimenopause. You can have products causing acne. You can have medications causing acne. So the distribution is also very different. In kids, you usually have that T-zone. You have the chest and the back involvement. Whereas in adults, you'll usually see the chin, the nose, the jawline distribution. So those are some of the differences, and then the treatment really depends on what's causing the acne.
When it comes to that for kids, especially, and we all deal with this, but how much of it is genetics and how much of it is their own sensitivity to things, maybe what they're using or on their face?
Yeah, that's a great question. So I think it depends on the presentation of acne. So if it's your traditional comedonal acne, which are your whiteheads and your blackheads, those are probably traditional teenage acne. But if they develop the really cystic acne, the ones that are painful, not resolving with just your over-the-counter products, usually one of their family members also has a history of that type of acne.
Yeah, we know that teens of course get acne, but adults get it at the same time as well. Every once in a while I get one and I'm going, how's this still happening?
Why are we treating wrinkles and still acne? What is going on?
It's not fun when it persists past the teenage
years. Do you treat them differently when it comes to adult acne versus teen acne? Are there different products that should be more tailored to that?
The fundamental acne products are the same. So you're going to use salicylic acid based cleansers, you're going to use topical retinoids or prescription strength retinoids. So that's the first line treatment for acne, whether it's teenage or adult acne. Now again, if you have those hormonal components in adults, you are going to add some other medications that you wouldn't traditionally use with teenagers, things like spironolactone or things like that. So again, it's the causes, but the fundamental acne medications are similar.
How much does diet play a role in this? Because I think that is what people are concerned about. I've heard dairy before can cause inflammation and other things. How true is that?
It is true. Data supports that high glycemic index or high sugars can increase your acne breakouts as well as dairy.
So is there anything that we should avoid if you're struggling with acne, whether you're a teen or you're an adult? What are some things that you would say?
Sugar. And then if you can do like a low-fat milk or a fat-free milk, whether you're looking at those sugar levels.
Is there a low-maintenance kind of skincare routine that everyone can follow across the board?
Yes, I always think simpler is better. So gentle cleanser. Again, if you have acne-prone skin, you'll add that salicylic acid-based ingredient in it. You do a lightweight moisturizer and a sunscreen. That's all you need in the morning. And then at night, you do a topical retinoid. You can either use prescription strength if your acne is not responding to the over-the-counter products. And then a moisturizer at night if you need it, if you are using those retinoid products that can dry out the skin.
And
it's simple.
That's usually the key. I find too, I think the fewer products that I use, the better my skin does, because for years and years I was just using like 20 different things.
And products can cause acne. So you'll see people who wear a lot of hair products, they'll start developing acne on the forehead. Certain makeup can cause acne, so you get this comedonal blackheads, whiteheads with really thick pasty makeup. So you have to be careful. Less is more. Always.
Where can people find you, Clinique? You guys are local here in St. Pete.
Yes, we have offices in Clearwater and St. Pete in the Allendale area.
Perfect.
You can follow you on social media as well?
Yes.
Okay.
It's at the DC.
Thank you so much.
Well, thank you. Thank you for having me.
All right, let's get a check of the forecast here.